Hi everyone, time to find out what's going on with COVID-19 in Cobb County, and boy, there is a lot going on, some good, some not so good. The vaccines, they're arriving, but when? To get some answers, I trucked down to Cobb and Douglas Public Health and County Services Parkway to talk to Dr. Janet Memark, who tells us that even though we've been in the middle of a surge, it appears like we're in a post-Thanksgiving lull, but she thinks that is misleading.
It looks like we've gotten a slight reprieve just for a few days, but I don't think that's going to last very long. Cases are now at 292 cases per 100,000. So remember, that's 3 times the rate of what's considered high transmission. We have over 26,000, almost 27,000 cases. I want to remind people, though, that that does not include the antigen tests, those rapid tests. And so those have become very, very popular. And on last count, we had about 700 of those that just for this 2-week period that was positive. If you include those, we are well over 300 cases, closer to 360 cases per 100,000. And that's probably what people are feeling right now. If you are like me, you're probably seeing a lot of your friends get quarantined at this point. And if you have students in school, they will get quarantined because it is mirroring the community transmission. So as the transmission in the community goes up, it will be brought into the schools. And so more and more children will have to be quarantined as we get positive cases. To piggyback on that, hospital systems are also very, very busy right now. At this time, usually, in a regular year, we would have a lot of influenza activity or flu activity. We're actually not seeing that. This is COVID-19 activity that we're seeing, as well as your regular medical issues that people are coming in with. We have critically low critical care beds in our system right now in our district, and our medical surge beds are low to critically low at this time. And we continue, we've seen a little tiny plateau of the COVID-19 cases in the hospital, but they remain very, very high. They are more than double what we had seen just a few weeks ago. So although we've probably hit a little plateau, I don't see it going back down. There was a lot of holiday activity, and the weather is very cold, and we're just seeing a lot of activity right now.
All right, so the big news is, and you hear about this all over the place, vaccines, they are coming. They will probably soon be approved. They'll probably be soon on their way here to Cobb County and Georgia, and probably soon will be administered to a certain core group of people.
Some really nice news coming out about 2 vaccines that have now applied for emergency use authorization. So we have the Pfizer vaccine and the Moderna vaccine. You may have heard about the Pfizer vaccine, which is the ultra cold vaccine. That doesn't really affect the general population as much, but that makes logistics for us a little bit more difficult, but we're working through that right now. The Pfizer vaccine is a 2-shot series. It has to be given 21 days apart. You have to take the same vaccine, so that will actually be tracked by whoever the administrator of the vaccine will be. So our state will be tracking a lot of that. The second vaccine is the Moderna vaccine, and that one has to be given 2 shots 28 days apart. It's more of a cold storage or a freezer storage, and that's more of a traditional way to store it. So we will take whatever vaccine comes first to us. Our understanding is that the Pfizer vaccine, because it's ahead a little bit, will probably have more of that hit the market first. Things that people should know, and I want to just keep reiterating this with people, that the efficacy is about 95% for both vaccines, around that, 94, 95. That means 94 to 95% of people who receive the vaccine will not get COVID-19 if they're exposed to it. So it's very important. That's a very high percentage, and it means that it is very effective against COVID-19. So that's one thing. The second thing is that there are some side effects that are associated. Some of you have, I hear this a lot. I got the flu from the flu vaccine. Well, no, it's usually that you're having some side effects from the flu vaccine. So this is the same thing. There are some people that will have some side effects. Of course, you're going to get the arm pain that we get from a lot of vaccines, but people can get some fevers as well. They're usually low grade. You can get muscle aching, and you can get that fatigue and tiredness. That sounds a lot like COVID-19, right? But if you anticipate that, in the first 3 days after the vaccine, then you'll know that you're probably not getting COVID-19. So those are important to know. The Advisory Committee on Immunization Practices just held their meeting just a couple of days ago. And so they're the ones that make the recommendation to the CDC on who should receive the vaccine first. So they'll make that recommendation, and then the CDC will adopt it, and then it will go to each of the states. And our governor will actually decide based on what our state is looking like and what the needs are in the state, whether they're going to go with that recommendation. The recommendation from the ACIP was to vaccinate healthcare personnel first. And so that is anybody that is having a high burden of face-to-face contact with potentially with people that have COVID-19. So it's your healthcare providers, it is your transporters, it is people that are, whoever is kind of face-to-face. It doesn't have to be the clinician, but whoever has this high burden of exposure. That's the first group that is also with nursing home patients. So you also have the staff, but that staff is also in that high burden group, right? So nursing home patients are also in that group. So that is the first group that has been approved for the first vaccine allotment that will come out. So I want to remind people, though, that first allotment is going to be a small allotment. So it is relatively small compared to our population. So we have to make sure that we prioritize those who we really need to be in place to take care of the rest of us. So, hospital workers, people who are going to be working on the front lines, those people that need to be vaccinated first. And so you'll hear more and more information. It's expected to be in this month, probably closer to the end of the month, that we'll see the rollout of the vaccine. There will be different providers that be able to provide it. So your health system will most likely be able to provide it. There'll be several pharmacies and doctors' offices, as well as public health, that will be able to provide the vaccine. It's going to be at no cost for the vaccine, although in some places there may be an administrative cost.
All right, the vaccines are coming. They will be free, but when will they be for us?
It will be a slow and gradual approach, and so you can kind of think of it as a ringed approach. And so as we get a small allotment of vaccine, the governor's office, using the ACIP recommendations, will find out who is the most vulnerable and who needs to be vaccinated the most, right, to keep everything running. And then more vaccine will come out through the weeks, just more and more will come out, and then we will slowly increase that, the number of people vaccinated. So we will be putting some stuff on our website so that you can follow and get more information. As soon as we get information, we'll be putting that information out to people.
So the arrival time probably before the end of the year, but it will really be maybe spring break-ish before any of us in the general public get a chance to get our arms shot up by that vaccine.
The general population, we're looking at probably springtime. So probably in April, starting in April, that we'll have mass vaccinations. In the next few months, we'll be trying to get all of that critical infrastructure, getting them vaccinated. And it's anticipated the vaccine will arrive from mid to end of the month is what we're looking at.
All right, one more thing Dr. Memark wanted to talk about was something else that's been in the news lately. New CDC guidelines about quarantining and testing after you've come into close contact with someone who has had or currently has COVID-19.
Some of you may have heard that the CDC just came out 2 days ago with new recommendations, actually yesterday's recommendations for the new quarantine recommendations. So first off, I want everybody to know that this is a local decision. It's a recommendation from the CDC, but we are awaiting our state's recommendations, which usually have more things in it that pertain to our state. So the quarantine recommendation, so right now it's 14 days. Everybody knows about the 14 days. They were lowering that to a 10-day quarantine. So, and that is only if you have no symptoms, right? And there's a large gamut of symptoms, anything from having a headache, sore throat, to runny nose, cold nose, and runny nose, congested nose, and shortness of breath, right? So it's going to go down to 10 days, or you can do 7 days and get a test, right? We recommend the PCR test is the best test because we have it available and we have a good turnaround with that. The antigen test is not as good at picking up COVID-19 if you don't have symptoms. So, it's not the best test to be doing. So, so this is the recommendation at this point, but we're awaiting state guidelines. So for right now, Georgia continues with a 14-day quarantine at this point. If you develop symptoms at any point, the recommendation is for you to get tested for COVID-19. Remember, if you are on quarantine, that means that you are a close contact and had a a high-risk exposure. If you develop any symptoms, that is a link right there that you may have COVID-19 and you should get tested. You can come still for free to our Jim Miller location. The core people are helping us at KSU and Life University as well. Those are all free tests, and it's a nasal swab, self-swab. You don't have to go all the way back. Our hours at Jim Miller will be changing on Monday, so I wanted to make sure everybody knew that. It will be from 9 to 3 now, Monday through Friday, and then Saturday will be 9 to 12. And so this is because of cold weather and our staff was hurting out there, so we're trying to warm them up a little bit.
All right, so note those time changes for testing out at Jim R. Miller Park. And Dr. Memark says, listen, look, there may be light at the end of the tunnel, but the way we're looking right now, we may end up going through the darkest forest before we see that light.
Well, there is a light at the end of the tunnel, but we are not there yet. And so we just recently this week in the United States hit the highest number of COVID-19 patients, and I think it was the second highest number of deaths in one day from the pandemic. Please, I don't know how to stress this enough to everybody that, we are not there yet. We have just a few more months to go, and you all will see that people are getting infected around you. So you know what works, and we just got to go a little bit longer doing those things. We have to wear our masks. Please do not gather. If you cannot gather outside of your immediate family, that is really the best recommendation at this point. Don't travel, especially to endemic areas. Do not be traveling at this point. Wash your hands, and you got to keep your distance from people. It is these small gatherings that are leading to bigger spread. It's not the 50 groups of people that we're seeing. It is smaller sleepovers and athletic teams and parties. Those are the groups that are spreading the virus right now. So please, just make it just a little bit longer so we can get there.